Hello, everyone. Thank you for attending this. I guess it's the last session, if I'm right. I'm very pleased to be here. My name is Gilles Babinet. I'm the National Digital Council Chair in France. I have to say, I was sick until recently, so I'm just getting in very suddenly. I didn't even do the preparation of this session. And therefore, thank you, Milana. She is not here. So anyway, thank you, Melody, who's not there, for preparing everything. I'll try to be the most accurate possible, but please forgive me if sometimes I'm a little bit lost. So the session is about AI in healthcare, trust, transparency, and ethics. What does it take? I believe it's very much about ethics. And we have some excellent and distinguished panelists to be along with me. Milana Trucl, is that okay? Yeah? Thank you. So you're Italian, and you're the Senior Policy Officer at the European Patients Forum. Thank you for being here. Jassi. Jassi Pannu, you are a physician and you belong to the Johns Hopkins Hospital and Research Center. Is that okay? Research Center as well? Yeah, it is, obviously.
I can explain that.
Yeah, okay, wonderful. Yeah. And Manika, you are from an NGO which deals with AI at a really large scale. It's a huge NGO, 200 people, right? Yeah. And you're from India as well, and you interact with patients, this NGO.
With the frontline health workers who...
Frontline, okay.
Frontline health workers.
Who themselves are
interacting with the patients and the end beneficiary. Yeah.
And Rohit, you are from the WHO. We hope you are doing well these days. And you work on ethics and governance overall, right? Okay, good. So let's get this started. So, we'll have like 3 different sessions. And the first one will be about what is the importance of trust? It's obvious for most of everyone in here, but what creates trust? How do we handle trust in itself? And how ethics falls in there as well. And I'll start with you, Milana. I understand that you did a very wide survey on AI in healthcare and its perception from the patients. Can you tell us about this a little bit? Because it will probably help us to direct the different questions of these panels.
Yeah, of course.
Currently,
Yeah, this one works. Thank you. So we did a patient survey for patient organizations in spring 2023, so it's a bit outdated. It was 2 years ago, and this year we're doing a new one. But the idea of the survey was really to assess the perception of patient organizations on issues linked to AI in healthcare. So we really wanted to see what there were ideas regarding the potential benefits, potential risks, and also to see if they knew if there are any applications of AI in either their disease areas or in their member states, in their countries. And also we really wanted to see if they were already involved in any advocacy, let's say in any advocacy at all on AI, and if they were part of any development of AI solutions. And the results were quite interesting. So we had, of course, the more positive side looking at the benefits. And I mean, the picture was really, I would say, very positive, because they really have seen all of the applications that can really help the healthcare and the patients and healthcare professionals. So a few things that they really think that they can help, that can help, and from which AI can benefit, were, for example, a better accuracy of disease, It was also the use of AI in the development of new drugs. It was also in the development and optimization of the medical devices. And then, of course, the help that AI can provide to healthcare professionals in making healthcare more personalized for patients, and also those tools that can help patients better manage their disease. However, when we ask them about potential risks, the major risk that they have seen was the bias. And so training in AI on unrepresentative and biased data was really seen as the biggest risk according to patient organizations. And then some others may be linked to safety, to lack of clear rules on liability and transparency. But I also have to say that some of these things then were also in the AI Act later, because this was 2 years ago. So some of them were already kind of approached from the regulatory perspective. And then some other things as well that are happening very much now, and this is that patients were a bit worried about the use of some tools, such as the generative AI tools in healthcare professionals' offices, without them being actually monitored or approved for healthcare uses, so like chatbots, just to make an example. And they were quite worried how these things are actually being used. And yeah, it's a bit difficult to assess if patients trust or not AI, because they see the positive side, they see the negative side. And we are often also asked if we can actually trust AI if we don't understand it. And it's an interesting question, but I think that you don't really need to know all the technical aspects of AI or any medical solution to trust it. Just to make examples in comparison, we've been using MRI scans, we've been using so many different devices, blood detection, disease detection devices, and we don't really know how that works as a patient community, but we trust them. And we trust them because there has been standardized use, long used. We know that our healthcare professionals have the expertise. And I think this is also what's now missing from their perspective. We need to see that they know what they're doing, and they have the skills and knowledge on how to use it.
Okay, it's interesting because it brings immediately the question, is there some standard in the field? Do we have some norms applied to AI? And maybe, Rohit, you're the best one to address this question.
Yeah, so just around standards. So the World Health Organization has been looking at how to develop frameworks and standards for AI, including with ethics, since about 2017, but really started to take it more seriously from around 2020. And I think already by that point you had over 100 standards that had already been put in place. The OECD had already, I think, developed some initial guidelines, and then you had some specifically in health. So I think realistically having one sort of universal set of standards isn't likely. But I think academics who've sort of studied the different standards across the board see some convergence on certain principles. I think there's also sort of in the background certain tentpoles that sort of make it easier to have convergence. So, we have the Universal Declaration of Human Rights. We have, of course, the general principles on bioethics, which very much converge with and influence, I think, the standards that we see in AI ethics. And then we see data protection laws, which I think thanks to the work of the European Union have now been implemented really in the same format globally. The real challenge that I think we're going to get to in the panel is around implementation. So it's not, people can write the principles, it's if, companies and governments and institutions engage in ethics washing, and that's really the concern we have.
But if I get you right, it means that depending on the culture, you need to adapt the standard, right?
Yeah, I mean, I think there's maybe, that's a question of emphasis, and I think also the channel that's being used. I mean, certainly depending on the culture or the country or the political system, there will be certain standards that are emphasized more. But again, I think some of the systematic studies show that there's really a lot of convergence as to what's being used, but how it's implemented or who sort of has authority to implement it will differ.
Interesting. Very good, very good. So, Jassi, AI is really already there. It's widely used in the public. And do you think that there are some strong barriers from the end user in the way we might use AI in the near future? Or you believe that the trust will come progressively or is already there. What could jeopardize this trust if it does exist, or what could create this trust in the first place?
It's a great question. And before I dive in, just want to say thank you to Gilles and also the Data Hub for hosting this great event and bringing up these important topics. I work at the Center for Health Security, which is part of the Johns Hopkins University, and we were founded by the physician who led the WHO smallpox eradication campaign 25 years ago. So since then, we've focused on protecting the public from large-scale health disasters, whether they're pandemics or they're climate-related. And one of the things that we're thinking about is the intersection of AI and public health and how AI will be used in the public health system. And when we think about trust in public health, in AI for public health, I see it as an extension of trust in public health writ large. And there we have many challenges that are unique to public health. And it's very interesting and great that your comments provided the patient perspective. I think patients are to some degree wary of AI, but they also see tremendous benefit and potential personal impact. But when you think about public health, oftentimes you are dealing with healthy people, which is wonderful, of course, but healthy people don't necessarily feel that direct personal impact. But what they do worry about is their privacy, their data protection, and infringement on that. And those are issues that we deal with public health in terms of just requesting people to take vaccines and the hesitancy around that. And so thinking about how AI intersects with those issues, I think that there are ways that we can promote trust in these systems. One of those things will be transparency. I think that it'll be important for the public to understand how the algorithms are being used, what decisions they're being used for, and what of their own personal data is being fed into these systems and how it's being used. I think there are some technology solutions that could be applicable here, something like federated learning where you can actually protect the privacy of the data of the individual, but still train your self-learning algorithms. But trust and transparency, they can be lost easily. I think that one example that comes to mind is recently in the Netherlands, there was a scandal related to a self-learning algorithm that was used to allocate child benefits. And actually, that misallocation that was done by that algorithm pushed tens of thousands of people into poverty and really had direct negative impact on the public. And single episodes like that can actually cause widespread loss of trust in these systems. So I really feel like we need to think about building trust and transparency from the start as a design principle rather than trying to build it after the fact.
But sorry, it's a really naive question, but do I know as a patient that my practitioner is using AI?
I think that my own perspective is no, you wouldn't. If I was to use a chatbot, as you were mentioning, to look up something, there is no way for you to know that currently and how that algorithm or how that LLM influenced my thinking. There's no way for you to know, so it's a good point.
Should I know?
Yeah, I think that we should be thinking about, and I think many people in this room are probably thinking about how do we have systems, multimodal reasoning systems or LLMs that are meant for health and that have those safeguards built in and that the patients know this is the system that's being used and it's been tested in some rigorous way such that it's providing correct information.
Okay. So, Manika, the first question I'd like to ask you is, why didn't you go for profit? You are NGO, you have, like, I don't know, 60% of AI experts. It's very valuable. You can do a lot of money, and you didn't. So that's my first question for you.
So I'll start by talking about Wadhwani AI. We are based out of New Delhi, and it was founded in 2018 with this whole perspective of where AI is making big in the industry, what exactly it can do in the social sector, and particularly in a developing country like India. And right now we are applying AI, and the change to apply AI from just being a research organization happened during pandemic, all hands on deck, and we actually needed disease modeling, disease surveillance tools, decision support system, and from there was no looking back for the organization, and we started applying AI to develop, evaluate, and deploy solutions for social impact, particularly in healthcare. Our goal and our mission is basically to strengthen the digital systems which the government has made, to augment them and create digital public infrastructure and digital public goods. And also, most of our solutions are low-cost, scalable models, which are free for the end beneficiaries. And I think that's what makes us different from a commercial startup. And given that we're working very closely with the government, with the Ministry of Health and Family Welfare, and other ministries as well, most of the problems we are dealing are of national priorities and of interest to the government. So we end up embedding our solutions with the existing portals and the existing channels, and make it a digital public good. So, yeah.
You mean digital public channels?
Sorry?
You mean digital public channels? When you said you embed it into channels?
Yeah, so if the government already has an telemedicine portal for reaching the rural areas, right? We would add on features such as if they don't know how to type, they can just there could be an ASR model, and they can the speech to text kind of feature is there, where they can talk in any dialect, given India is huge and there are different dialects, different languages, and they can input their information, right, through a healthcare provider at a village level. So what I meant is that these portals already exist, the government platforms already exist. We are adding AI features to it to strengthen it and to fill in the gaps which are there.
Okay. Yeah. And you know, sorry if it looks a little bit as a provocative question, but you are addressing very poor population overall.
Yeah.
And, you know, I may be tempted to say, is ethics not something as a luxury on top of the service?
That's a good question. I think what we are trying to do is, rather than reaching the patients directly or the end beneficiary directly, for us, we are working via the system. That's how we are able to ensure ethics as well, and make sure that it is incorporated at every step, because we are working via these frontline health workers who are present at the village level and who are dealing with the patients, rather than giving our tool directly to the patients. So it is managed via the system, which is there at the last mile, to ensure ethics and to make sure it's not a luxury, but it's integrated.
I believe it's also ethics towards the practitioner, right?
Yes.
Yeah. Okay. Interesting. So, Rohit, quick questions. How do we scale ethics? You know, and because we all know that this system are here to scale. It's the main asset in some way. You know, you can multiply the number of practitioners thanks to AI and so on. But is ethics scalable?
Yes and no. I mean, I think, you know, obviously with the AI Act in the European Union. So I think the first answer is there are specific, obviously, mechanisms that we have. And I think the AI Act in the European Union was a sort of a good first attempt at trying to bring some of those principles into the legislation, with the difficulties of having to sort of retrofit the legislation at the last moment to try to keep up with the changes that were occurring with the emergence of generative AI. And I think obviously that becomes harder to do when you're sort of trying to manage different expectations. I think in our experience, we also see that regulatory standards are an important place to put in some of the ethical sort of requirements, although that the problem there is that I think a lot of the applications that are going to end up being introduced into health systems actually are not going to reach the level of qualifying for regulatory approval, and so it will be harder to sort of ensure that a regulator can actually ensure that some of these standards are integrated. And then so I think where you have to do is take a step back. So one area that we're sort of looking at very carefully now is at research ethics, where when you think about it, all sort of applications that emerge originally start as a research project. And one of the challenges that we're seeing is for research ethics committees that are actually reviewing and have oversight of the different types of AI that are actually being introduced through research proposals, that they are unable to regulate them and they don't necessarily have the principles and standards in place. And so we're trying to work with research ethics committees around the world to sort of think about how they change their standards and also be able to implement them so that the research stage that we can kind of get this right, because the sort of transition from a research project to commercialization is much faster, for example, with an AI technology versus a drug. The other part is, as everyone talks about, is ethics by design. So ultimately, how do you integrate ethics into the design of a technology? And that can involve, obviously, who's developing the technology to ensure that it's much more inclusive and it's not just sort of, I started my career in Silicon Valley, and there's definitely a type of person that mostly is involved in designing these technologies, and it tends not to be, let's say, looks the same as most people around the world. It obviously matters in terms of the types of data that's being used, and it also matters once you actually introduce the technology. One of the problems that I think we're concerned about is, fine, a technology might be introduced in a lot of different places at the same time, but whether or not it's actually updated to account for the different contextual challenges that different countries have or different settings have will really depend on whether or not it's profitable. And so I think we're concerned about whether or not then you can follow through. So sorry, no easy answer in terms of scalability. I think that the point is just going to be that. And then finally, just to say, I think in our experience in trying to work with developers, there is this disconnect between a healthcare professional and a medical professional versus somebody who develops a technology. So people who work in healthcare have certain ethical standards that they have to abide by. People who are designing these technologies are often disconnected from those ethical standards, and I think they are interested in them, but they also find a challenge to translate those ethical standards into programming language. And so one of the things that we're doing is trying to work both with programmers and with ethicists to try to bridge that gap between the two.
Can you a little bit develop the notion of ethical by design?
Yeah, sure. So the idea is essentially, first of all, ultimately who's developing the technology. And so it really begins with ultimately how consultative the process is. It's a question of ultimately what types of data that you're training the technology with. It's ultimately in terms of the forms of transparency you have and how you develop the technology, in terms of the conversations you have with health systems and regulators up front to be sure that the technology is actually suited to the context it's intended for. Yes, and then it's ultimately the choices that are made in programming and technology to make certain choices that ideally will sort of make it easier to actually integrate these ethical principles. So that can include questions around bias, it can include questions around explainability, it can include questions around the carbon footprint and the water footprint of a technology. There's different techniques you can have to reduce the carbon footprint and ensure that it actually can obviously not be as expensive or as wasteful. And it can also include, for example, developing a technology in an open source format, which can include more democratization and inclusivity in terms of the decisions that are made and how technology is developed and adapted.
The one thing I feel is it's complicated. From what it seems horribly complicated, actually. Milana, you deal with overall patients' feeling and the way to interact with them and so on. How would you take into account the ethical needs, and how would you make sure that the AI developer, which, as Rohit just said, are not necessarily the one who are the most, having the most accurate understanding of these notions?
Yeah, and I agree with what you just said. Also, because it doesn't matter if it's AI or not. Medical devices or solutions very often are indeed developed in isolation. So one of the first thing for me would be this change in also this culture shift for developers to understand that the patient input can be very valuable. It's valuable because then you can create a tool that corresponds to patients' needs, healthcare professionals' needs, of course, and we need to involve them as well. And also, very important that sometimes we forget is that if you get patients' input, it can actually be useful for the success of the tool. So it's also a commercial benefit for developers to involve the patients and the users. So it can be healthcare professionals, hospital managers. So that was one thing. And There are ways of doing that. So you can, for example, create advisory panels with patients. They can bring up questions that maybe the developers didn't think about. They can be linked to ethics, to safety, usability, accessibility of those tools. And then we also need to make this difference between the tools that can directly affect the patients. And in those tools, we really want to be involved. So there should be co-design. But then there are also those, and let's say these can be, I don't know, the tools that help the management of the disease, but can also be when you use AI, let's say in clinical trials. So there are different types. And then there are also those tools that are not directly impacting patients, as for example, using AI for drug discovery in molecules. They're not directly impacting my safety at the beginning. So it's not that we need to be involved at every single level, but there needs to be a discussion on where we can where we can give this input.
Yeah, okay, but here I have a direct concern is looping the feedback is great, and coders, we do that all the time, and it works really efficiently. But when you have hard standard, how do you deal with that? I mean, you need to comply with the standard. And so if it's an ethical standard, how do you deal with that? You try to... You get the question? More or less?
Yeah,
no?
More or less.
My point is, if I listen to what you just said, I can start from very low. And therefore, I don't care. I'll wait until someone complains, actually.
But this is why you should involve patients already from the research question. So why are you building something? Is it really useful? Is it really bringing some benefits to the healthcare systems, to patients, or whoever this is going to benefit from? Or are you just creating something that maybe already even exists and you just want to apply it to healthcare? So even if you're complying with some standards, it doesn't mean that it's actually bringing any benefits.
Okay. So there needs to be a level playing field already in place in some way, whether it's hard or not.
Yeah, and as I said, it depends also on the direct or indirect impact, of course. It's not that, patients want to be really involved in every development or at any stage. There are some stages where you can provide better input, more valuable input, and some others where you don't have the technical knowledge. So it really depends also on what we are creating.
Okay. Jassi, I have a question, which is another, I would say, interesting question, I believe. When you have some, like COVID crisis or thing like that, huge crisis, do we still need to care about ethical principle? I mean, it's about saving lives or, trying to... I can tell you interesting stories about that, but you certainly can too.
Absolutely. I think all of us saw during the COVID crisis that when things are moving rapidly, it is hard to build things at that time. And it's hard to build trust when there's an ongoing crisis, and it's hard to maintain transparency during that crisis. It's hard for governments to completely share information, and that's partly a policy problem, but also partly a technology problem. If your technology was not built from the outset to be able to easily share that information, you won't be able to do it during a crisis. Speaking from the US perspective, our public health system is decentralized. And during the COVID crisis, there was no centralized mechanism to collect data or to share it easily, and that was a huge problem. But that's not a problem that can ever be solved during the ongoing crisis. It has to be built from the outset. But I think, so with regards to ethics by design, trust and safety by design, patient involvement by design, we all want this to be thought of in advance. But I think we can all also recognize this technology is moving incredibly quickly. So how do we make sure that we're doing this from the outset while this technology is racing away from us? I think efforts like the EU AI Act are really important. I think to two-finger to Rohit's comment on what institutions and universities can do. If any of you are from universities, think about what your ethical review committees are doing. Do they understand these algorithms? Do they know how they can review the research in advance to provide guidance? And if you're not sure, reach out to them and see, because probably they haven't thought about it yet, or they would love to have additional help thinking through those challenges. So yeah, I think that's thinking about it from the outset, but also recognizing we can't sit back. We really have to move as fast as the technology.
But do you think it's a matter of like predefined systems? And for instance, is there some guidelines already existing for such very rare condition where you have a global crisis? Do you have some guidelines?
Well, I think what I would say is that you can't build trust during the crisis. Trust in your institutions, in your government, in your algorithmic systems needs to exist in advance. And thinking about, okay, well, we know probably there's going to be an upcoming crisis. How do we make sure that trust exists? I think one thing that I recently learned was that, for example, trust in government in China is actually quite high.
Yeah, very high.
And us as democratic nations, we find that difficult to understand, perhaps. But the reason is because Chinese citizens really see the day-to-day impact of what their government does in improving their own lives. They feel like 5 years ago, I lived this way. Now, 5 years later, my life is much better. And that's because I see the direct action of my government. And so thinking about what are the ways that we as governments, as institutions, can show the benefits of these tools and try and build trust that way in advance.
Even though there was a very profound distrust during the COVID crisis in China as well.
Fair enough, yes.
It's, you know, in France we had a quite interesting and I would say hectic story with a Bluetooth app which attempted to define who you crossed. To prevent the people, to tell them that you've been contaminated and that they should be careful about not being contaminated as well. And it was a complete failure. And there was another guy who created Brise la chaîne, break the chain, which was the same approach but proactive. You would go in your agenda and try to redefine what you did and who you potentially met and tell those people proactively, which was downloaded like, I don't know, 4 million times, while COVID Tracker, the other app, was a disaster. No one wanted to use it because it was done by the government and people felt that the government would obviously upload the data to track people, whatever. Anyway, long story short, it didn't work at all. But, you know, based on that, a quick comment. I think it's a lot also about what I would call an AI culture. Don't you think?
I'm going to take a guess. I mean, in the Silicon Valley, the culture is move fast and break things. Yeah, and that is the opposite.
Beyond that, normally. It
yes.
should be beyond. Yeah.
Right. We think about healthcare as do no harm. And now those two kind of cultures are clashing in a very important way in terms of it'll bring lots of benefits, but also how do we make sure that we do no harm with these systems that are designed to move fast.
Okay, good. Very good. Excellent. So I'd like to have a small comment from you on, overall this event and the reports that's been done on, actually I'm not aware, but I understand that there was a report agreement on AI in healthcare being announced this morning by President Emmanuel Macron. I'm supposed to know everything he does, but regarding this AI thing, I'm not aware. So I'll let you comment. Who want to start? You want to start, Milana?
I very briefly took a peek at it.
Yeah, you too. Thank you.
Yeah. So I didn't really, I didn't go very much deep into it, but it was great to see so many signatories from so many different countries. We were just talking that we've seen a few missing, such as the United States and the UK.
In the UK?
In the UK, we didn't see it on the list.
You know why?
I don't.
You don't?
But on the other hand, I was also wondering, it's nice, to have this collaboration and both, to just put together the resources and also to share the knowledge and to share the best practices. But it's a bit difficult to see how then you're going to actually implement it in so many different regulatory contexts, cultural contexts, landscapes. So it's a bit just difficult for me to see how it will actually work.
Okay. Is someone here knowing the content of the no, you don't?
I mean, I've read it also very quickly. It's quite short, and I mean, I don't mean to, I'm speaking personally now, not organizationally. So, it kind of mostly reaffirms a lot of things that have already been written, and introduces a few new concepts, which I think is important, especially on the environmental aspects, which I think is great, because I think that's sort of certainly increased a lot in concern since the UK's summit. But yes, I mean, for me, it's ultimately about how this is going to get implemented, and frankly, if especially the largest technology companies will pay any attention to this, whether it's possible for other countries. When you think about most low and middle income countries today that are facing, not necessarily India, but a lot of other countries are facing significant debt crises. They don't necessarily have the regulatory infrastructure to put these standards in place. And, quite frankly, those that are introducing these technologies aren't consulting with them in the first place. So it looks good on a piece of paper, but, once you start to think about how this actually plays out in practice, both for countries that are much more focused on the commercial and the military and the geopolitical competition, and others just simply don't have the resources for it, it falls short. And so I think until we start focusing on exactly how you put it in practice, it's very easy to kind of keep replicating these declarations. But we're just going to see more investment and more technology, and not necessarily more, basically just more ways of actually making the principles work in practice.
Has China signed the deal, the agreement? No?
I don't know, actually.
You don't know?
I would have
Someone knows? We'll check in the meantime, Manika?
I think I second what Milana and Rohit have mentioned, and it would be good to see how the implementation happens, especially the cross-learning part, how with the different context in different countries, how do we adapt and learn from that? So, yeah.
Okay.
Jassi. But not least, I did check. China has signed.
Ah, they did. Wonderful. It's
But,
a big chunk of the population, no?
Yes, yes, absolutely. And just to jog all of our memories, this AI Action Summit is part of a lineage of summits that have been held in Seoul and the UK. And to second everyone's comments, it's great to have this reaffirmed commitment to responsibility, safety, security, trustworthiness, transparency. But where is the implementation, and where are the actual concrete commitments that we need in order to make sure these principles are upheld? So I would just encourage everyone, in particular in the EU context, your role is even more important than ever before, given the global geopolitical climate, that you can really hold the companies, developers accountable to really prioritizing these commitments that they've made publicly. Hold your government accountable, hold the companies accountable, because without that pressure, it's an economic imperative to move quickly, and it's really our role as the public to do that.
Yeah, the thing which struck me a lot during this conference is this summit actually, is the notion of competition. It's really, I mean, it's really almost a war. It's against other territories, like mostly the US. Actually, it's quite interesting, and I believe we'll know for sure within the next maybe decade, or if it was right to put the norm first. I believe so, but the US don't actually, and they removed everything. So and there will be some industrial, commercial, ethical accidents for sure. But in how long and how much, we obviously don't know. Thank you. I'll take the question from the floor. If there are surely plenty. Yeah, I can see a lot. So I don't know from lady actually over there, please. You need a mic, probably. Yeah, thank you.
Bonjour à tous. I didn't participate in the whole day, but I'm curious. I'm based in Paris. I one of the projects I work on is creating learning tools for face-to-face interaction, whether it's in school or in hospitals or in companies, to build a kind of natural barrier against AI. Not to eliminate it, not to eliminate the mobile phones, but just to develop a culture of very healthy in-person interaction. And my question for you is, you know, do you see there being kind of a structured approach from policymakers in developing what I would say is a healthy offline culture?
Okay, who wants to?
I will say this is not my area of expertise by any means, but I feel like healthy online culture is the exact opposite of what is trying to be achieved, because the amount of attention and the amount of time that you spend with these systems is directly correlated to gain by the developers. And so I think there's no incentive for that, so it's great to hear about your effort.
Just not to reframe it, but but I will. I think the issue that we often think about is what's the context in which we're introducing these technologies? So, you know, the WHO will talk about a shortage of 10 million healthcare workers globally by 2030. I think a lot of European countries after COVID, and also as there's more restrictions on migration and also challenges of getting people to stay in the healthcare system, is leading to encouraging the use of AI much more, and also especially chatbots in healthcare. So the context we have is essentially trying to substitute for the lack of investment in our healthcare systems with AI-based solutions, and ultimately having healthcare systems which will be like, you know, a tale of two cities. It'll be a luxury to have basically in-person consultations, and for everyone else, essentially, you might have to rely much more on sort of chatbot-based approaches. You see that already in other areas. So that's my concern, and I feel like I'm channeling a bit of education, for example, that you're thinking about, and that's something, for example, living in Paris, that's being very hotly debated today as to, you know, what is the separation between traditional offline learning versus basically pushing kids into AI-based approaches, and I think health systems are going through that same dilemma.
One else? Yeah.
Just to two-finger to that, I completely agree. What is the reason that we're developing these systems? Imagine if a patient anywhere in the world could have access to the best physician possible through an AI system. So that is an incredible achievement. So yeah, it's a balance for sure.
Interesting. Yeah.
Yeah, I have a response to your provocative question about ethics. I think that without ethics and transparency, there is no trust. And I think we felt that very badly in France with the apps that you've mentioned. It was a total catastrophe. But there was a solution. And look what they did in Taiwan. And they developed an app. Then they went for an open source data that app that was done by ethical hackers, and everybody trusted it. So it's possible, even during a crisis, to stay ethical and maintain that trust.
I was, the day before yesterday, I spent most of the afternoon with Audrey Chong, who was the digital minister by then, and who had a very critical role in coordinating the different ministers. You know, Taiwan is the best country in terms of COVID response after New Zealand. So both are islands which is actually the management of the crisis, but still they have been very good at it, and I believe that the digitalization response was the strongest of any other country. It was incredible. I could do a whole keynote about that, which, you know, luckily you won't have, but it's fascinating to see.
Hello. Yeah, about trust, transparency, and ethics, I have a very concrete question to Milana and also to Rohit. Don't you think that one very important aspect of trust, transparency, and ethics for the citizens, for the patients, would be a right to have real access to your own data for all healthcare tests that you are doing with AI and with other means, and why there is a kind of law existing in the US, but as far as I know, there is nothing in Europe, nothing in France, nothing in, or almost nothing in Belgium, my country. So what are your proposals in this direction, and why doesn't exist anything really now at the moment? So the possibility for the patient to just have his own health data and also to share it, you know.
It actually is. So it's called European Health Data Space. So it has been agreed. It's going to enter into force very soon.
But it's I know a lot about the EHDS, but the problem is it doesn't exist yet. Okay, it
doesn't exist yet, no. But I mean, you have to start from somewhere. So at least we have it now. It's going to be implemented in the next years. Probably in 4 years, you might have access to all of those data. You'll be able to share it. I know it's still in 4 years, but it's also up to the member states to work on their own records, to work on this, on giving the access to data, and for you the ability to share it, with whoever other provider you want. So there are some things the EU is doing them, but yeah, I understand that at the moment it's really up to the member states at the moment, and some have it, some don't, unfortunately.
Yeah, I don't have much to add. I was just looking at the example in Denmark, for example, where they've developed a much more sophisticated system to link together all the forms of data, including things that might not be characterized originally as health data, which is part of this discussion, so that it can be both given by the patient, it can also be used by researchers in a way that's anonymized. Personally, I think it's good that it's going much more slowly. And I was just looking at reports in the United States of, essentially where you don't necessarily have the regulations in place, and so you have these forms of data acquisition and data sales in which large amounts of data are essentially sold on the open market in ways that essentially, violate a lot of potentially privacy standards and potentially, ultimately lead to real harms. So I think the slow and steady approach is a good one, even though obviously there's a lot of benefits to come from it over time.
If I can add, it also depends really on the member states, because when you have many, like in Italy or Spain, when you have so many different regional healthcare systems, you also need to first make sure that they're interoperable, that they work with each other, and then you can also scale it up. But it's going to take some time, of course. And we do have investments already from the EU money, indeed, in the member states, and we're trying to do them. But it's taking time.
We have some more questions. Incredible. It happens. Usually there are so many questions regarding anything which touches on AI. Very surprising. Okay, so you know what? We have some time left, so I'll ask each of you, what do you feel is the most important solution? Concrete solution, what should we do next regarding the implementation of AI, of ethics in AI? Salut Cédric.
I think the most important thing is, and which has been emphasized in the earlier sessions in the day as well, and discussions, is looking at context-specific solutions, where the demand and the needs of the beneficiaries or the users is considered. The AI solution is not made in silos, but to one of the points which Milana also mentioned, that it is designed with all the key stakeholders, including the user and the beneficiary. That's the key, also because that also ensures trust when their buy-in is there from the beginning. And they understand how the tool is going to benefit them, how is it going to integrate into their day-to-day workflow, what is the incentive of doing that, right? And also they understand the limitations which come with the tool, along with the ability to actually override the AI decision if need be. Yeah.
Just because, I want to be concrete, is it a focus group before using the product, or is it a permanent process, or both?
I think it's both.
It's both.
Yeah. So how we work on the ground as well is during problem selection, We have the key decision makers from the government end, but also the people on the ground having their voices, who are going to use the tool. Are they even comfortable? Do they have access to the technology? Which interface, which channel is more trusted, where this feature should be integrated, AI-based feature, right? And then once the model is developed, even during the process of data collection, looking at how accurate and equitable data representation is there. Given in a country like India, there's so many diverse groups. Do we have that fair, transparent data collection process which is representing all different groups, right? So looking at that, and then when we actually deploy it, there's a lot of learning when we pilot it. And before even the pilot, there's a process which we follow, tying back to the question, feasibility testing, not just of model performance, but testing it with a smaller cohort. What are the iterations that are required? And then actually going into pilot, where also there is continuous improvement over a period of time. So yeah.
Thank you. Rohit?
Just quickly, I think it's interesting. We were developing this guidance on research ethics, and one of the things that sort of came up is essentially AI is becoming unexceptional, right? So it's just everywhere. And at some point, we're going to stop looking at it as this object that sort of exists outside of everything else we're doing, and just seeing it as sort of integrated into every facet of the scientific process of medicine. And so, you know, my answer is much more old-fashioned. As somebody who's worked in sort of health and human rights and ethics for a long time, I think, you know, it ultimately comes down to a really robust civil society. It comes down to ultimately having good journalism. It ultimately comes down to democratic participation. It's all the things that traditionally have made healthcare successful and trusted, and has kept people honest, and it's ensured that ultimately for, you know, because of just the political economy between companies and governments, you're not going to necessarily have that arm's length separation between the two to ensure that you're keeping companies honest. And so what I've always seen, at least over the last few decades of my work, is it's ultimately going to come from the bottom up. It's going to come from civil society. It's going to come from journalism. It's going to come from those types of mechanisms that ultimately ensure that we take this on the right path.
Jassi?
I think this field is moving very quickly, and it's an incredible challenge for governments and companies to think about all of the things that could go wrong, all of the principles they need to take into account, all of the stakeholders that they need to work with. I think it's just simply too hard to try and accomplish everything given the speed. So I would really push people to think about the risks and the harms that could lead to loss of life, and laser focus governments and companies on those, given the speed of the technology.
But can we predefine those risks?
I think that we should try, and that should be something that we shouldn't answer without having given it an attempt to try and figure out those risks.
Okay, thank you. Milana?
Given that it's going so fast, I sometimes feel like there is this idea of digitalizing for the sake of digitalizing, and I just think that we need to move a bit from that. So if you're doing a tool, it has to, the AI, the digitalization, it's not a goal, it just can be only an enabler. But if you're not really using it to make the healthcare system more accessible, more affordable, to give better health outcomes, to help healthcare professionals, then it's just another complexity. And actually some healthcare professionals are already seeing that it's just a complexity rather than an enabler. So I think that's one of the first things that we should also focus on when we try to build these new tools.
Okay, I now need to thank you all four. It was wonderful. I've learned a lot of things personally. I hope you did too. And thank you for coming from abroad, from everywhere actually. And yeah, let's keep working on this incredibly important topic. Thank you so much. Thank you.